Good morning. I'm Dr. James McKay. I'm a hospitalist here. First of all, to all our veterans out there, happy Veterans Day. Thank you so much for your service. I served for 21 years in the U.S. Army, so I appreciate all that you have done and the sacrifices that you and your families have made. So happy Veterans Day. But I'm coming to you in the capacity of a hospitalist here and to bring you up to date with our COVID-19 experience. We currently have 35 patients total in both campuses. There are 20 here in the Martinsville facility and 15 in Danville. We feel that we have adequate supplies in terms of nursing, in terms of bed capacity, in terms of medical supplies to handle that volume of patients and more. We look forward to taking care of your needs. If you are feeling ill, do not hesitate to come to the hospital to get attention. That being said, I wanted to talk to you first about the visitation policy here at Sovah. We continue to operate under a limited visitation policy. If you come to the emergency room, you are allowed one visitor, one well visitor, to come with you. By well, I mean they're not having active symptoms. They must, of course, wear a mask wherever you are in the hospital, but we do allow that. So emergency room patients are allowed one well visitor. There are exceptions, of course, to this policy, and we make those exceptions on a case-by-case basis. You can go to our website at sovahhealth.com for the latest guidance on our visitor policy. The policy is located on our COVID-19 preparedness page. You'll find a link to this page at the very top of the website. Now, as far as our holiday guidance, the final 2 months of the year are racked with holidays. You know, we have Thanksgiving coming up, we have Christmas, we have New Year's, and the tendency in times past is to have large gatherings. We're going to have to do that a little differently this year. We're going to have to avoid large gatherings wherever possible. Think in terms of indoor events versus outdoor events. The weather has been very fine this past week, and it may offer an opportunity to have our gathering out of doors. There's less tendency or likelihood of contracting the virus in an outdoor situation rather than indoor. Now, as we continue to fight COVID-19 and work to slow the spread in our community, are certain things that you can do. Mask wearing, social distancing, frequent hand washing, keeping your hands out of your face are just a few of the things that you can do to help limit the spread. And of course, if patients or family are traveling from out of town, have them be vigilant. If they are ill, if there's a possibility of them being ill, if they've had a recent contact with a person, it may be better for them to stay put and to not possibly bring that infection to us here locally. It may be that you limit the gathering to members of your own household. And again, as we said, if there's an opportunity to go out of doors to do that. Now, the current number of COVID-19 patients in both our communities and in any communities where potential out-of-town guests may be accumulating has to be taken into consideration. Limit the number of guests. Provide masks, provide hand sanitation, provide gloves if need be, and of course separation wherever possible. You may even consider asking your guests to wear masks or to bring their own supplies. Like many things this year, 2020 has been different. It's going to play out until the end of the year. The good news this past week is that of a vaccine in the works, one by Pfizer. And there's also good news out of Great Britain of a potential vaccine. We think we may have that probably by the spring, March or April. But in the meantime, masking works. Social distancing works. Hand washing works. The virus cannot live outside of a human body. It needs a human host. So when we give that virus that chance, then it has an opportunity to replicate. So I want to again thank you for your time and for your consideration for spending time with us for this COVID-19 update, and we'll be bringing you more messages soon. Thank you. Stay safe.